A very good morning, children. How are you all? I hope you have understood the previous class which we have spoken on the diseases, right? So today we are also going to see another topic, which is signs and symptoms. Signs and symptoms of a disease. So here, for example, if a microorganism targets, right? No, if a microorganism goes inside the body, we have seen that it will target the tissue or organ, isn't it? So if a tissue is targeted or if an organ is targeted, then what happens here, right? You can see changes in our body. Okay, for example, if you take the lungs, if the target organ of the microorganisms, if the microorganism infect the lungs, right, what are the symptoms you can see? What are the symptoms you can see? The symptoms will be like cough. Okay, so if the lungs are infected, what are the symptoms you can see? You can see the cough. Second one, what you can see is the breathlessness. Okay, so what you can see is the breathlessness. Breathlessness in the sense here, unable to breathe properly. Okay, so these are the two symptoms which you can see once if a person is infected. Okay, and especially the microorganism target the lungs. Second one is if the liver, if the target organ of the microorganisms is liver, then the disease which can be caused is the jaundice. Already we know what is a jaundice, right? Already we have discussed it yesterday. We call it as Pascalu, right? So what happens here is, whatever the bilirubin and biliverdin, these are the two salts which are present, or you can say bile pigments which give color, they are present in the liver, right? And now this one will come into the blood. This will enter into the blood, and if the quantity increases, actually that should be eliminated out with the urine. But whereas if the quantity increases, what will happen here is that particular salt, or you can say pigments, will enter into the blood. So once they enter into the blood, they travel throughout the body. So the blood, which is now yellow, kind of yellow in color, when it travels in the hands and all, you can see the color of pigment, right? That is yellow color in your palms, okay, in your eyes, and also your feet. Okay, so that is how you can know that if a person is absolutely white, like milk white, so you can see the person becoming a bit yellow in color. So these are the symptoms, okay, which you can see in the disease called as the jaundice. So that is how the microorganisms will target like the liver, the person can be caused a jaundice. Okay, and third one, for example, if if a person is targeted on the brain, if a person is targeted on the brain, that means the microorganisms, if they target the brain. So what are the symptoms you can see in that particular person here? So here, the first one, what you can see here is if a brain, now we have seen the lungs. If the lungs are targeted, cough and breathlessness will be the symptoms. Already we have discussed what are symptoms. Okay, if you have any doubt, you can go to the previous videos. When the liver is targeted, what are the symptoms? Yellowish color, right? And that will lead to a disease called as the jaundice. Okay. Now, for example, if a brain is infected by the microorganism, that means if the target organ is brain, then what are the changes? What are the symptoms you can see here? First thing is, you can see here is vomiting. The person will frequently vomit. Second one is, you can see the person will suffer from the fits. Already we know what is fits, and fits here can also be called as convulsions. They are also called as the convulsions. So fits you can see here, convulsions you can see here, and third one what you can see here is the headache. Third one which you can see here is the headache. So these are the different symptoms, okay, which you can see when a brain is completely infected by a microorganism. So here you can see these three, we have taken some different types of things, and also one more, brain, if it is infected, you can see the unconsciousness. This also, that is a person, he will not be in a conscious state. Right now we are talking, we are listening, and also we are in conscious state. For example, if you sleep, So you'll be completely unconscious, right? Now, if the brain goes unconscious, what will happen? You can see the people who are in coma, okay, the people you can see who are in the brain dead condition. So they are completely unconscious. For example, if you don't eat food in the morning time and then when you go to assembly, suddenly what happens? You'll fall down, right? You'll become unconscious, and then you'll be taken to the first aid center. You'll be given some glucose, okay, food and all. Then you'll recover. So by the time, what will happen is you'll become unconscious. So that kind of problem will be there. So these are all the symptoms, okay. So when an organ or when a tissue is infected, okay, then by the microorganisms, and if they target one particular tissue or one particular organ, so these are the three examples I have taken, especially the lungs, liver and the brain. So these are the symptoms you can see in that particular people. So now apart from this we are going to see one more example also, okay. So these are the infections you can see when organs, okay. So liver is an organ, lung is an organ, and brain is an organ. So now what about the tissue? What about the tissue? So when tissues get infected, you can see different kinds of changes here, right? So we are going to discuss the same now. So when tissues are infected, you can see some changes in your body. For example, when, okay, let me put this to you in this way. When tissues are infected, you can see the swelling in the tissues, you can see the pain in the tissues, and also sometimes there will be fever, swelling, pain and fever. Now, why these symptoms you will see, right? What is the reason for these symptoms? So that is what we are going to discuss now. So this will completely depend upon the body's immune system. Okay, so nowadays we are hearing this word called as immunity, right? So the complete system now depends upon the immunity we have in our body. So if you have a very good immunity, then what will happen here? The body will fight with the microorganisms which are in the tissues or which are in the organs. So if they are fighting with the tissues or microorganisms which are infected in the tissues and all, so then there will be swelling, there will be pain, and also there will be kind of fever, because this particular fight between the immune system and also the microorganisms, they will cause these kind of things like this, swelling or the pain or the fever. So here you can see that immune system. Now what is the immune system? Now in the blood we have three kinds of cells. One is RBC, that is red blood cells, and then there is WBC, that is white blood cells, and then there are blood platelets. Okay, so these blood platelets are helpful in clotting of the blood. So whenever you have the wounds and all, then the blood should be clotted. So the blood platelets will help you in the clotting. Whereas RBC here, they are red in color because they have a pigment called as hemoglobin. They help in the transport. Of the oxygen from the from the lungs to all the cells of the body. So it's a kind of carrier of oxygen. And now coming to the WBC. These WBC cells, there are 5 different types of cells. There are acidophils, basophils, neutrophils, monocytes, and the lymphocytes. So all these 5 white blood cells together, you can say that this is the immune system of our body, because they will fight with the microorganisms which enter into our system. So immunity is nothing but having the WBC in our body, which will be able to fight with all the other microorganisms which enter into our body. So immune system, it should be perfect. So, and nowadays we are using the same. So if you have very good immunity and all, you are not getting the corona, right? You're not seeing even if the virus enters also, you're not showing any kind of symptoms, and that will that's nothing but the immune system. And also if your immune system is weak, then immediately you are infected with the corona. So this is how we are being now differentiated between the people having immunity and people doesn't have the immunity. So if you have the immunity, then your WBC will fight with the disease causing microorganisms, and that will maybe cause this swelling, pain, or the fever, and the other different kinds of symptoms you can see, because your body is fighting with those microorganisms. Okay, children. Now, if a person is infected with the AIDS, what if a person is infected with the AIDS? We will see that one now. So children, if a person is infected with AIDS, right, that means he is infected by a virus. That is human immunovirus. Human immunovirus. So this human immunovirus, that is HIV, right, that will cause the condition which is called as AIDS. That will cause the condition called as AIDS here. Right now, that means here AIDS in the sense is acquired immunodeficiency syndrome. So here you can see the word called as immunodeficiency. What is immunodeficiency here? That means your immune system become weak completely. Your immune system will completely become weak. So that is how what happens here is, if your immune system completely becomes weak, that means your body will not fight with anything. For example, if you get cold, if a person who is suffering from the HIV AIDS, if a person is suffering from HIV AIDS, if a person gets cold, that will immediately convert to pneumonia. So in each and every one of us know, like, that will not get converted to like pneumonia directly, because we have the immunity and also we can fight with the cold. So but here, whereas here, because there is no immune system in our body, right, people who are suffering from HIV, their immune system will be completely damaged, okay, and that degraded, and that is why even a small cold also will convert into pneumonia. And also, if a person is suffering from simple gut infection, and that will immediately convert to diarrhea. It will convert to diarrhea. So even the small infection, gut infection also will be converted to diarrhea. And if you get fever, that will last for very long time, because the immune system is deficient here. The immune system is not functioning properly. So that is how you can see the word disease which is called as the AIDS here. Okay. So and now because of this, we can conclude with one particular point here. That is, if the microorganisms in our body, microorganisms which are causing diseases, if they are less, then symptoms will be very less and negligible, and also they will go unnoticed. Okay, that means only when you have the proper immune system. Okay, because this immune system will fight with the disease causing microorganisms, and when the number becomes completely less, even the symptoms also will not appear, and within no time what will happen, the disease will go unnoticed and you will not see the disease also. Nowadays so many people are suffering from corona, but they don't know whether they have the corona or not. So they are not showing any symptoms, but when they go, they are tested positive, but they don't show any kind of symptoms in their body. So they are immune to that particular virus because they have very good immunity in their body. So in the same way here, if the microorganisms are very less in our body, then the disease will be unnoticed and negligible, and you cannot even the disease also will not appear, right? No manifestation will be there. But whereas if the same microorganisms are huge in number, that will definitely result in a disease, where our immune system fails to kill all the microorganisms, that will definitely lead to the disease. So what are the symptoms you can see, and all the symptoms which you see, that will lead to the disease. So this is how you can see these signs and the symptoms. Okay children, so that's all for today, and tomorrow we'll meet again, right? And we will continue the next session, that is principles of treatment. Until then, see you all. Have a great day. God bless you.